Rabbits have a lifetime longer than most people think. They may expect to survive for 8 to 12 years on average. When it comes time to say farewell to our dear friends, time might seem to fly by. But, whether your rabbit dies at a young age or develops a terrible illness, we will ultimately have to let our bunnies go and cross the rainbow bridge. A lack of appetite, a loss of strength, and unpredictable movements are the most frequent signs of a dying rabbit. Other symptoms will vary depending on the cause of death, and you may not notice any before a rabbit dies. If you observe any of the signs on this list, don't give up on your rabbit. Your rabbit may be able to recover if they receive immediate attention. However, if you observe numerous symptoms from this list, you should be prepared for the worst. Lack of appetite. A lack of appetite is something you will see almost any time a rabbit is sick, and it can be a very dangerous symptom. A rabbit's health depends on the constant movement of their digestion, so their condition can quickly deteriorate if the rabbit isn't eating. If they don't eat for more than 10 to 12 hours, the rabbit is in a serious situation that can result in death. If you notice that your rabbit isn't eating and get them to the vet as soon as possible, they can still recover. Since this is a symptom of so many illnesses, the vet will be able to determine the cause of your rabbit's lack of appetite and treat the underlying condition to bring your rabbit back to health. Seizures. Seizures are more common among rabbits who reach old age and die of natural means. Often, the cause of the seizures cannot be pinpointed. However, it is linked to abnormal brain activity caused by infections, blood clots, poisoning, head injuries, or genetic conditions. Sometimes the cause is a common parasite known as E. cuniculi. This often lives within the rabbit for a long time but doesn't become a problem until the immune system weakens in old age. The same can be true of the bacteria that causes snuffles in rabbits. It can live in the rabbit's nasal passage for its whole life but cause an infection in the inner ear or skull after the rabbit has a more compromised immune system. It's important to note that many rabbits can live long lives even when they have conditions that cause seizures. You can manage the symptoms with a lot of care and supervision to avoid further injury. However, if this is a symptom with a sudden onset in old age, it's often a sign of a serious disease. Erratic movements. It's also common to see erratic movement. This is when the rabbit seems to dash in a straight line for a few steps and then almost falls over. Then they'll repeat this behavior again in another random direction. The rabbit might crash into furniture and objects in their vicinity because they are unable to control their movements. This is another sign of a neurological abnormality related to seizures, even though technically it's not the same thing. Loss of strength or balance. Similarly, you will notice your rabbit struggling to walk around or even remain in an upright seated position when they are beginning to pass on. This is when their muscles are no longer strong enough to hold them or keep them balanced. When my old bunny Tenchi died, she kept falling over when she tried to sit in a loaf position. She had to lean against something to remain upright during this time. I knew the time was coming for her. She was 13 years old and had been suffering from arthritis and respiratory problems. Trouble breathing. You'll notice many rabbits struggle to breathe. In many cases, this is because the rabbit has contracted a respiratory infection. The infection is causing wheezing, shallow breathing, or abnormally deep breaths. You may also notice mouth breathing, which is a clear sign that your rabbit is in distress since they do not normally breathe through their mouth. You might notice your rabbit holding their mouth open, or you might see its lips spread apart for each breath. Mouth breathing also causes drooling, so you might also notice a wet chin. Respiratory illnesses can be treated, so take your rabbit to the vet for emergency care if you notice they have trouble breathing. However, sometimes rabbits who are in pain will breathe abnormally as well. It's not always an indicator of a respiratory infection and may be one of your rabbit's coping mechanisms for dealing with the pain of a different serious illness. Abnormal fecal pellets. Because a rabbit's digestion is so important to their health, you will probably notice a change in their poop when they become seriously ill. The type that you want to look out for include small poop. Fecal pellets that are a drastically smaller size can indicate pain or stress. Deformed poop. If the fecal pellets are small and deformed, it typically means your rabbit is eating enough. Double or triple merged poops. When 2 or 3 fecal pellets are merged into one, this is an indication that the rabbit's digestive system is slowing down. It's normal to see a few of these abnormal types of poop in your rabbit's litter box, even when they are healthy. However, if most of your rabbit's fecal pellets look deformed or reduced in size, then there is likely something wrong, and you need to get your rabbit medical care. These signs can be an indicator of several different illnesses, so you'll want to get a diagnosis from your veterinarian to know what the problem is. A dramatic change in behavior. When a rabbit is seriously sick, you will notice a change in its behavior. Typically, they will suddenly be incredibly low energy. The rabbit won't want to move around, and they may not even react to any affection you show them. You may also see the rabbit lose all interest in grooming themselves, making their coat look dull and raggedy. In other cases, the rabbit may suddenly become aggressive. Even if they were previously very sweet, the rabbit would suddenly snap at you whenever you come near. This results from the frustration they feel when they are in a lot of pain, so don't take it personally. Screaming. Rabbits do not normally make any loud vocalizations. However, they can scream a haunting, high-pitched sound. You will typically only hear a rabbit scream when they believe they are about to die or when they are seriously injured and in great pain. While there are some exceptions to this for rabbits who will scream more frequently out of fear, I have only heard a rabbit scream in the moments before death. Blood in their urine. It is not common to find blood in a rabbit's urine, but it's never a good sign. Most often, when you see this, it is a symptom of uterine cancer in unspayed female rabbits. Once it gets to this point, it is rare for a rabbit to recover from cancer. Less commonly, blood in the urine can signify a urinary tract infection or some kind of severe bladder sludge. As a note, red urine does not mean it is blood. While golden yellow or orange urine is most common, red urine is also standard. It's usually caused by foods that the rabbit eats, or sometimes a round of antibiotics can cause red urine. You are looking for red spatterings or drops of red in the otherwise normal urine. A low body temperature. As rabbits get sick and begin to fade, their vital signs will also change. Typically, this will result in a low body temperature, a weak pulse, and rapid breathing. The average rabbit body temperature should range from 101 degrees Fahrenheit to 103 degrees Fahrenheit, while the pulse should be 150 to 300 beats per minute. The breathing rate should be one breath every 1 to 2 seconds when the rabbit is at rest. A rabbit's ears can give you an idea of its body temperature and pulse. To check their pulse, locate the long vein in your rabbit's ear and pinch it between your fingers. You should start to feel a rapid rabbit pulse. The temperature of the ears can tell you a little bit about their body temperature. Very cold ears indicate a drop in body temperature. If you want a specific number, you can use a rectal thermometer to measure your rabbit's body temperature. Diarrhea. Diarrhea is a symptom that is actually more common in very young rabbits. This is especially common in rabbits who were not correctly weaned from their mothers. Baby rabbits should continue to drink their mother's milk until they are about 8 weeks old. This helps them build up their immune system and digestive health. Rabbits that were orphaned or weaned too early often don't have very good digestive health and can suffer from severe and life-threatening diarrhea. This is why it is illegal in most places for breeders to separate baby rabbits from their mothers before they are 2 months old. Adult rabbits can get diarrhea too. This is usually a result of eating some kind of poisonous food and is also a life-threatening condition. If you enjoyed this video, kindly press the like button. Also, don't forget to subscribe with notifications on, so that you don't miss out on videos like this. Thank you for watching.